Here's where we left off from the previous lecture. So now we're going to talk about signs of muscle fatigue from different strengthening programs. And these signs can vary. It's not about if the patient or client has muscle fatigue, they're going to demonstrate all of these signs, but these are potential signs that you could see with a patient experiencing muscle fatigue. So then you would need to decide whether or not the resistance is too much, if there were too many repetitions or too many sets, and then modify accordingly. And remember that it is definitely within the scope of practice for the PTA to modify the exercise program. So either backing down from the resistance or adding resistance, increasing the number of sets, increasing the number of reps, etc. That is within the scope of practice for a PTA. So some changes that can occur from performing resistance exercises, which reinforces why they are important to do. It can improve motor learning and coordination when doing resistance exercises. Obviously, the muscle is going to change and you'll notice hypertrophy or increased muscle bulk. And there could be connective tissue changes like stronger ligaments and tendons, but remember we can't train specifically ligaments and tendons, but if we're using exercise to train the body, then the ligaments and tendons will provide more support when we do our proprioceptive exercises or single leg exercises, things like that. And then obviously you should be familiar that increased bone density occurs with weight-bearing exercises, but it does take a significant amount of time before you notice these changes. So one of the more difficult spots to figure out with strengthening exercises is how we figure out the right amount of resistance to start with. So there are some strategies that we can use to try to figure out the right amount of resistance to start with. And those are the DeLorme and Oxford methods that we're going to talk about as we move forward with the slides. But looking at the 1 rep max or the 1 RM. So the rep max is, we're either going to have the 1 or the 10. And the 1 is how much that the individual can lift only 1 repetition. And then the 10 is the maximum amount of weight that the individual could lift for 10 reps. So obviously this involves a lot of trial and error, and the more that you test the patient out on trying to figure out what their 1 rep max or 10 rep max would be, then they're eventually going to fatigue, so it's not going to be very accurate. So these are some general ideas, but again, in the clinic, not always the most applicable because we really don't have time to spend with our patients to figure this stuff out. So a lot of it is guessing and experience. So one of the ways that we can start for resistance is the rep max. So either the 1 rep max or the 10 rep max. Usually about 30 to 90% of what that 1 rep max would be or the 10 rep max would be where we would start. So if the individual has a 1 rep max of 100, then we could start with anywhere from 30 to 90 pounds of that 1 rep max to begin our exercise program. So you can see how there's a ton of variability and not really anything that is standard. This uses figuring out where to start for resistance, obviously taps into an individual's clinical experience. So the more that you start practicing with patients, you're going to have a ballpark idea of where you would start for resistance. If you have any experience with how your strength training has gone, that can also help determine where your patient might start with resistance. We could have universal percentages regarding leg press or leg extension. These are just some general ideas. So if we were going to start with a leg press, we could use 50% of the body weight, or if we're going to start with a leg extension, we might use 20% of the body weight. But again, these are just some general guidelines. And then finally, we could have our clinic protocols, either from the surgeon, who would want you to start with certain types of exercises at certain phases of healing and recovery, or clinical protocols where facilities use standard guidelines, either from clinical practice guidelines or from their own experience working with certain clients, that they develop a protocol on how to progress patients who fall under that diagnosis or that common condition. So now how we establish the volume in exercise, so how many repetitions or how many sets. Again, this is generic guidelines. There are set guidelines using Oxford and DeLorme that, again, we'll talk about later in the presentations, but these are just some general guidelines. I think that most folks in therapy tend to kind of err on the side of what they're comfortable with. So you'll hear a lot of 3 sets of 10, 5 sets of 10, something like that, but usually in increments of 10. That is traditionally what people do. And again, I think it's to err on the side of caution, or they just don't really think outside the box. I tend to do odd numbers. That way the patients kind of stay more engaged with counting, and the 3 sets of 10, there really is no science behind doing the same weight 3 sets of 10. There's more science in trying to do either a drop set or progressing each set with more weight. So the 3 sets of 10 though tends to be the most common formula. So how are we going to improve strength? If you remember what we talked about earlier regarding a strength program should have high intensity, low duration, you're going to be doing anywhere from 6 to 12 reps, so not a lot of reps, 2 to 3 sets, and you want the individual to feel fatigue at that last rep. Then you know that you're overloading so that you can create strength change. But you also want to have the break in between sets because strength also improves during that rest. If you're not giving that patient the rest in between sets of 30 seconds or more, then essentially you're doing one long set of reps and not really strengthening. Then it turns more into endurance. If we're going to improve endurance, we're going to look at low intensity, high duration. So you're doing a lot of lower weight with a ton of repetitions. So now you're going to go well over 20, doing lots of sets. You could either do by the number of sets or have them repeat the exercise for a length of time. But you want to make sure that you're using low weight and high reps. So the distinction between the variables for strengthening and endurance are very important to know. And this is definitely important for the exam. And when we're finally get a chance to apply these strategies in a lab setting, you need to understand the difference of what the formula would look like for strength and endurance. So to reinforce that for strength, you would be using high weight with low reps. And for endurance, you would be using low weight with a lot of reps. And when we're looking at intensity, we mean our weight. So it's high weight, low reps for strength, low weight, low intensity with a lot of reps for endurance. So one of the things that's important, or why endurance exercises are important, is because type 1 fibers, which tend to be the ones that do our low intensity endurance type activities, tend to atrophy faster than type 2 when immobilized. So that's why we would want to be sure that we're including endurance exercise for a rehabilitation program. So now when we're looking at the variables of the exercise, so frequency is looking at how many exercise sessions, either per day or per week. And this can vary on intensity. So if we're doing a lot of weight, then we're obviously not going to exercise those same muscle groups back to back. So this is why folks that train tend to have like their upper body days and lower body days, chest and back days, however they break it down. If they're using a lot of weight, you need to have that time in between. So the frequency of exercise is going to depend upon the goals and objectives for what we're trying to achieve with the program. How long folks need to do exercise. So this is going to incorporate our reversibility principle, so that folks need to understand the importance of continuing with an exercise program. It may take a while to see results, and then if you achieve the results and don't continue with some type of exercise program, it's very easy to slide back into old behaviors or old patterns. So you have to maintain some level of exercise. So you, especially as a PTA, are going to be providing that information to patients, and that they need to understand compliance with a home exercise program is crucial and is going to need to be maintained for an extended length of time. One other variable that's important and a lot of folks don't necessarily take into consideration is that it's important to include rest into a training program. So you need that rest in between sets to make sure that you're using your energy reserves, but you also need to have rest in between your bouts of exercise. So you need to have a rest day in your exercise to prevent risk of injury or over fatigue, which would then lead to a lot more signs of muscle fatigue, like the twitching, compensatory movements, things like that. So when we're looking at the type of exercise, this can vary depending on what the objectives are, but you have a lot of factors that are taken into consideration when you're looking at the mode of exercise. So by resistance, we're looking at free weights, Cybex machines, TheraBand. We're looking for muscle contraction. This is going to be the difference between isometric, concentric, and eccentric. By position, whether or not the patient is going to be in a gravity minimized or against gravity in an open chain or a closed chain. The energy system, so are we looking for anaerobic burst activity, or are we looking for more aerobic long-term endurance conditioning? And then how much range of motion we want the patient to actually be using during the exercise. So if we're going to go through the full range, or if we're going to cut it back to a limited amount of range if we're trying to protect an injury or surgery. The speed of exercise can be affected as well. So if we're going to be looking at how fast we want the patient to do the exercise, looking at power, or if we want them to take a longer period of time, like with eccentric exercises, so that we can kind of focus on technique or focus on really contracting the muscle in that way.